today the demonstration is really around outpatient mental health. So there's probably many of you here that are excited about seeing mental health pieces of this, but I would say if you're here just more generally interested in Expanse or in outpatient clinics, you're going to get some things out of this today as well, because there is certainly a lot of similarities between outpatient clinics in general and obviously, you know, how mental health would use that for outpatients. So I'm super happy to have our colleagues from One Hits here. So for those not familiar, our program Bridge is what we're calling sort of the group of organizations in the Northwest that is working together to implement Meditech Expanse. And we are members of, all of our organizations are members of One Hits, which is a larger group out of Northeastern Ontario who've gone live now with 23 sites, and we are joining as 12 additional member sites. And so they really are the experts in sort of how to roll this out, and we're super thankful for their help and their guidance in all of this. And they've graciously agreed to spend an hour with us today going over these workflows and what some of this content looks like.
Sorry about that. Okay, so this is how you launch in to the ambulatory module. You go to ambulatory and you go to the clinical home screen. Okay, just gonna move the pictures of us. Okay, so when I log in, so as you can see, this is blank right now. So in ambulatory, you work from the schedule. So the first thing I'm going to go do is go look for my schedule for today. I'm going to look at the acting. Okay, so you can see I have 3 patients booked for today. So if I was already a provider or a clinician in this clinic, this would auto-populate, but because I'm not, so I had to go and look it up. So as you can see right here, I have 3 patients, pretty light day. So if I go up here, I can look really quickly and just see how many patients is total for today. And it'll tell you how many is in the morning, how many is in the afternoon. It'll also show if there's some canceled appointments, so it's quite nice. I can actually go to another day, but I don't have any appointments booked for tomorrow. So here's today. So just to give a little overview very quickly, because like I said, we don't have a ton of time today and we have a lot we want to show you. This just shows me some recent patients that I've looked at, and these fall out, I think this is after 7 days. You can close charts from here as well. Up here, you just see my name when I sign in. This is my own button. Workload, that's more for physicians. And the sign queue, I'll talk about that as we get into documentation. The menu just gives you more options, more things that we can do. Like I said, we won't get into all the details of this today. We certainly focus on this in training. And just, there's a help button. You can look up some help online if you're on the screen, and this shows that it's me that's signed in, what domain, what job, and things like that. And then if I wanted to close right out, I can close right out here. Okay, I know I'm going to go a bit fast, so just if it's too fast, let me know. I just want to get everything in. So here I have 3 patients on my grid for today. As you can see, the time of their appointments are here. Right here, these little caution signs shows me that there's some special indicators on these patients. So I click on this one, we can see, and this is all access driven, and there's a whole policy on special indicators, and these are flagged on chart level so that we can see them in all modules in Meditech. So as you can see, this patient is flagged for C. difficile, a physical impairment, and it has a violence indicator on it. Okay, so based on access as well, you could go in and edit here if you have access. Just so you know, so that's really good right up front, so you can see it right there. And then obviously it just shows their date of birth, things like that, when they arrive, what their status is. It will tell here how long they've been. And here just tells me if there was, like this one shows that there's multiple documents open on this patient. And this one is showing me that there's nothing open right now. But it's a little bit of an overview of that. Well, I think that's pretty good for that one. Okay, this is a patient that I'm going to use today. Okay, so then when I click on the patient, I launch right into the chart. Okay, so I don't know if any of you have seen the chart overview. I'm going to do it fairly quickly. Some of you might have already seen it. If you have more questions, just ask me. Just could take quite a bit of while to go into detail of all these tabs. But basically, this is the patient's chart. And this is what you see up here on these chart and on these little folders, little file folders, sort of. This is across all modules. So if the patient went into Emerge or they went into your inpatient services, this is shared documents, shared information. So basically, if this patient had any diagnostics, you'll find it here. You'll see this patient has some blood work. You can always change the time frames, or you can narrow down specifically if you wanted to look up something more specific. Provider notes is what it says. It's usually physician notes. It could be a nurse practitioner as well. And basically this shows me, as I can see here, and all the provider notes goes into different categories based on their specialty. So I can see here, this patient's had an emergency visit, it's had a cardiovascular and some general. So if I go into this emergency visit, I can see that this patient was brought in by a police officer, gets into a little bit more detail. Our physicians usually dictate in real time. So this is on the chart very, very fast as they do real-time dictation. Really, really great information when you're reading the chart. Then I go over here, it's all the nurse allied documentation. So everybody has their own category, but as you can see, so for assertive community treatment team, they have their own tab. So any documentation that they do, I think you have a similar program, and in that program, obviously we have nurses, we have social workers, we have PT, we have a variety of disciplines, and all their documentation will go under this team note. And these are nurses' notes. This could come from in the hospital, could come from some other program. Some of this came from our ED when the patient was seen in the emergency department. You can see here that they saw other services. So obviously, if they've seen various clinics, services in your area, it will all be listed here. Most patients has this huge list. So this patient has also been to addiction services. So you'll see their notes. One has been into the crisis service and a hand clinic. So this is where you see all the notes. You can also filter over here. If you, obviously, as these patients has been in our system for a long time, there's been a lot of notes in here, so you can do some filters. You can filter it by just outpatient, just by emerge, inpatient, and you can do it by time as well, just to make it cleaner to look at. Medications is what it says, medication tab, if they have any meds, any home meds or anything listed on this patient, you'll see it all under this tab. Or if they have been in our hospital, you would see, and you'll see history as well. History and problems, really quickly. The problem list comes from physician documentation. And you can also see this over here on the reference panel. You can see a lot of things are duplicated in the chart. Allergies are here, they're elsewhere in the chart, but the history and problems are also down here on the reference panel. If I go down right here, same thing. So you can access it right here. You can do updates here, or you can do it in here as well. So definitely, again, this is all based on access. The nurses do the past family social history, and the physicians do the problem list. Administration is what it basically, it's your administration tab, demographics, things like that. Insurance, other clinical is a mishmash of a lot of other things. Allergies are in here again, they're over on the reference panel. So tons and tons of information going here. Who's part of the care team, some forms. We have any immunizations that were given will be here. Implants come from our surgery, but you will see everything across all visits, just to give you some idea. Workload, mostly for physicians. We won't really get into that. But the summary panel, I kind of did want you to see because, okay, so the summary panel they're called widgets. So, and they're very customizable. So this is really, really helpful. It's sort of, from a nursing perspective, I think of it as sort of like a Cardex view of the patient. And you can switch out these. So basically right here, what I set up just for the demo today was these are the ambulatory visits that you can see. If there's any upcoming appointments, you would see them here. Special indicators, the ones we talked about before, they're here as well. Any diagnostics, outstanding orders. So you can see some of the other ones. If you want to see weight, you would go in here. Pharmacies, we do enter the pharmacies on our patients, but over here I made it a little bit more specific to mental health. So you can put some personal notes. I kind of like this. This is only for you and only for your viewing. Nobody else sees it. So if I wanted to kind of remind myself when this patient's coming back in, I can write myself a little note as a reminder, and I can take that out. It doesn't stay a part of the permanent chart. And then we have this mental health care providers and contacts, which is very helpful. This comes from the documentation on the clinician side. It can give us all the information that you might need on your patient, who their community supports are, their CTO, some expiry dates, all that can be there. If there's any upcoming mental health appointments, so in the system, if there's an appointment within our Expand system, you would see it up here under their appointments. But if we have external appointments, so like, they might be going to the dentist or they might be going on site, they can do documentation and it would fall in here so that your staff can see it. If there's any legal indicators on our patient, it would come in here. The physicians enter orders if the patients are on any forms or anything like that. So that would all go in here. And this is this one here is a CTO expiry date. Yeah, some other things. So there's labs, and then there's a My widget. So you can sort of like take components from other widgets and put it into your own widget. Again, that doesn't affect anybody else's view, it's just your view. Okay, I just want to show you quickly. So when you go into here, so these are all the widgets that I set up, but there's tons and tons of widgets in our system. I have maxed out mine, so I'm just going to take one away just to kind of show you. So I don't even know, I'll just start by A, I guess, but there's tons and tons of widgets in here that you can add and customize that would best fit the clinic that you're working for. There's lots and lots in here. You can also move things around. So if you wanted this over here, you would just move it to this side. So you really can customize it to what works for you. Sort of like a little personal cardex. I think it's really helpful. Under the activity screen, basically it's just chronologically everything that we've documented, everything that's been done on this patient chronologically, which I really like. Obviously this can get pretty big as well, but it shows everything in real time. And again, you can always go in and filter if it's too busy, and you can say, I only want to see ambulatory visits, I only want to see emerge, I only want to see inpatient. You can turn whatever filters you want just to make that a lot shorter, cleaner. Flow sheets, I will quickly touch on this, but I think Leanne, she's going to demo in a little bit some of the medication ordering and some medication management that we do for this team, for this clinic, and she's going to show a little bit more of this. I thought I would just show you a little bit. So the flow sheets, basically, you can show trending on different things. There's quite a few flow sheets done as well. There is one for community mental health and addictions, and basically it's just to see in a flow sheet mode, this one has a mental status assessment, it has the opiate withdrawal scale. It will only show what's documented. So there could be more things on this flow sheet, which is if it's not documented against it, you won't see it. And as you can see, this comes from all entries. So you can see some of this data came from an emergency visit, this came from an ambulatory, and this came from a clinical visit. So it shares all the information. Show health management really, really quickly. So health management is something very, very specific to the ambulatory module. So basically, this is a health management protocol that we have developed for some of our clinics use this in North Bay. So basically, some of the clinics really struggle with how to track some of this data on some of their patients that's long-term, especially some of their ACT patients. They could be obviously on the ACT team for many, many years. I think prior to going to Expanse or prior to this, they were doing some of this like on an Excel spreadsheet. So basically, this is the way that they can keep track of certain things that they want to track on their patients. You can add documentation in here as well. They can update manually some dates when things are due. just show you very quickly so they can take things off of this protocol if they wanted to as well, and they can also add things to it as well. Just to give you a little overview. I think we covered pretty much everything here. Basically, it just gives, you know, the names and demographics, and this is an ambulatory count, and this is an intake. We could change if this was a big clinic where you can change this and say they're in the waiting room, or they departed, or they went somewhere. That's some functionality. Some clinics do it and some don't. And here, yeah, we've just listed, like I said, some of the more things that we want to see really up front on the patient. Allergies, special indicators, all meds, and like I said, it's always duplicated. Okay, so I'm going to go right into documentation. Just want to make sure Leanne gets to do her spiel. Okay, so like we said, we have a lot of documents built for lots of clinics. I just brought in a few today just for you to look at. So basically what we do in training is, if this was an ACT clinic and we were doing training, they would just favorite their ACT documents. They wouldn't want to see everything that's in the system because there's a lot in the system. So they wouldn't want to see all that. So we basically say to them right off the bat, first thing to do, favorite your documents. If I was only working in this clinic, I wouldn't want to see this other stuff. I did load a few other just to give you a sense of what they look like. So basically this is an admission document that's built for the ACT team. This is just a one-time note. This is their discharge. This is a part of their medication administration. As you can see, this is their crisis plan that's used throughout their journey. And this is definitely looked at when they go into our emergency department. This one of our patients reports to the emergency department. This I know for sure. And we have a lady on our team from the emergency department. The physicians always look up the crisis plan and see what services this patient is affiliated with. So I just thought I would show that. So I'm just going to pick one. I'll just pick the ACT admissions just to give you some idea of what this looks like. So I'm going to cancel that. But so basically we've built templates for these clinics. So basically we've tried to put everything within these documents that you might do on an admission. That's not saying you're going to do all this, but it's all in this one template so that you don't have to go looking for it. It only files to the chart what you complete on this patient. So basically you're doing your full intake. You're probably going to do a set of vitals. You know, what type of, is this the initial one? Who was present for the appointment, things like that. Were they in the hospital since the last visit? You can do your past family social history here as well. This is a specific intake. I could put T for today, and I'm not going to answer all this, but I'm just going to answer just a few things. So you see how it files. This is a consent. This is quite big. Basically, typical big. It's a big intake assessment. I don't know how big it was. And then you have your infection control screening. That's supposed to be done on all admissions that come in. We are required to do an outpatient falls risk at most of these clinics. This is another consent form. This is the one where I show you the care providers and contacts that goes over to the widget. So this is where you would fill in this information or make any updates. This is where you would do it. If you have any questions, just stop me. This is the mental status assessment that is used across the continuum, inpatient and outpatient. This is the mental status assessment that they do. There's lots of scales built in our system. If you're thinking about that, lots and lots of different scales. And I can just close it out just to make it faster. And then there's our crisis plan, our DASA, our Columbia suicide scale. This is the scale that is approved by one. And if I do this, it will automatically give you a scoring. This is if they just want to write a narrative note. And if they wanted to do a departure, they can do this as well. This is not mandatory, but they can. They can say they were accompanied. Some clinics like to do this for some statistical reasons and things like that. So basically, this is an admission assessment. So I am done. I am going to sign my note. Okay, so we're going to give that a Meditech minute, and then I'm going to show you where that lands in the chart. And while we're waiting for that, I'll just go back here and show you. So that's the admission one. So basically that one's done. You could probably unstar that one if you want, and it will fall off your list, or you can keep it for next time when a patient comes. And then your discharge, basically, I'm not going to go into it, but I'm going to just show you the discharge is pretty short, not as big as the intake, as you can see. The other thing you can do though is you can always bring in extra documents if required. So say, well, you know what, I'd like to do a set of vitals. I can go in here and I can add in, there's tons and tons and tons of assessments in here. And I could just bring in the vitals if I wanted to. So I could bring in like the BPRS or any of the scales that we do. I can do those as well. Okay, it's probably just throw in something here, things like here. And I'm gonna go just to give you an example of what it looks like. Okay, I should go back to the chart, and now I want to go because my notes should be filed by now. I can look in two places. I can look under Nurse Allied, or I can look under the Activity tab and see. And sure enough, there is my note signed. And you can see, like I said, only thing that goes in this note is what you have documented. Okay, and then if I go under the Nurse Allied, I'm going to find that note under your Servant Community Treatment Team. Same note right here. Any questions about any of that?
A couple questions in the chat. I don't know if you want to do those now, Carolyn, or do you want to?
I might get. I know that. Oh, I think Maria raised her hand.
Yeah, I was just going to recommend that maybe we move on to Leanne, and maybe Carolyn can address the questions in the chat directly.
So I know that Leanne has a hard stop. So I think Leanne is our pharmacist, and she really wanted to do a demo of the medication administration in this clinic and look at the provider piece, like doing prescriptions, if that's something that interests you. So I thought, is that good? Okay. Leanne, are you ready to take over?
Yeah, I have my screen that I can be up and
Yeah,
ready.
hopefully I can get back. I'm kind of afraid to stop sharing. Okay, it's all yours.
Hey, so I apologize. I was working a clinical shift today, so I've commandeered somebody's office to be able to do this demo. I'm going to go back into the same patient that Carolyn was in. And so this is the ACT Team 1 clinic for today and my patient. And I'm going to go into, hang on. It's looking very different for me. Trying to move something out of the way. There we go. Okay. So as you can see here, I've gone to the order section. And the first thing that I'm presented with is the patient's home medication section. And so this is the list of medications that the patient is on at home. Some of them, when it shows up as in a reported status, that means that it has been recorded through the system, but it hasn't yet been prescribed through the system. When it says prescribed, it means that a prescription has been provided for the patient via the system. All right. And this is a real-time medication list. So whether anytime the patient has had an interaction with the Meditech system in your region, and they've done a BPMH on the patient, that this list gets updated. And so it's always best practice to do a BPMH on your patient if you're doing any sort of medication management. And so if your clinic does sees the patient more than once a month, you may your clinic may opt to only do the BPMH on the patient or reconfirm the BPMH once a month or less frequently, depending on your clinic's practice. That is something that is decided upon at a site level. Okay, so here you'll see there's a button where you can go in and prescribe medications. And so this would be to write new prescriptions. This button here is to place orders for anything that has to be done within the clinic itself. And then to do a reconciliation on your patient, so to reconcile the home medications, you would click on this red reconcile button. So the first thing I'm going to do is I'm going to go in and reconcile. So the patients, no, hi Karen, sorry, I saw your question. So no, as I was mentioning, for those clinics that see the patient more than once a month, if you currently are only doing the medication history once a month or once every 3 months, you would continue to do so. Certainly the expectation is not to do a full BPMH when you're seeing them 3 times a week. Does that answer your question?
Yes, yes, it does. Thank you.
No worries. And whatever policy you currently have, you would follow the same policy. I just want to show you how you would complete the BPMH, okay? So here you're presented with the patient's list of medications. And here you'll see it's quite quick. So the patient can confirm they continue to take this, they continue to take this. Hydrochlorothiazide, yes, they no longer take the methadone and no longer required. The multivitamin, yes, they still take that. This medication is confirmed. They are continuing that, and I'll show you where we would have seen this, but the patient did receive this dose last week. And the reason why the patient is back this week is so that they can receive their ongoing Invega Sustaina dose. So I'm actually going to stop this one. And the original provider was Bruce Demers. And the only reason why it's asking me this is because I'm not a prescriber, okay? I'm a pharmacist, so I can't prescribe it. So what I would, in this case, in the clinic, it was a one-time order. It's already been given, and we know this because it was given in this clinic, and I would know this by following the patient. And so in this case, it was just a single order. I'm just going to put it through as a therapeutic intervention, so it doesn't have to flow back to the provider sign queue. Come on. There we go. So I'm just going to quickly go through and confirm this. Confirm. The patient is still taking the risperidone. They haven't finished stabilizing yet, so they will stop it in a few days. But they are currently taking it, still currently taking this, and we're good. If, when doing the BPMH, we realize that the patient is also taking something else, we would add the medication to the home medication list by clicking on the search button. And I know that the patient also goes to an addiction management clinic and receives Suboxone. Sorry, Sublocade. And I get this. Okay. Now, of note here, I'm reporting it. I'm not prescribing it at this point. I'm just adding it to the home medication list. Now I'm happy. I've confirmed all of the patient's home meds. I'm going to save it. And all this is doing is showing that you are stopping this one-time order for the Invega Sustenna because this was the starter dose that was given. All right. So now we have the new home medication list here, and you'll see that the maintenance dose of 100 milligrams IM Q30 days is on here. And the patient takes the rest of these medications as we were able to confirm. Any questions on BPMH? No? Okay. The next thing I'm going to show is how to place an order for something that needs to be administered at the clinic in the hospital, okay? This may or may not apply to your clinics in particular. It depends on the workflow that's determined by the clinic. So if something is being administered at the hospital in the clinic itself, the orders are placed this way. So essentially you're placing an office procedure order. So in this case, the patient is going to be receiving a top-up dose of clonazepam because they've been feeling a little bit anxious. Oh, maybe not because they don't have that at the clinic that we have. Okay, so this won't make sense clinically, but let's say we're going to do a clopixol depot. Okay. Please forgive me. I know it's not appropriate. So we're going to do 150 milligram dose once, and it's going to be given in today's clinic here, right? So with today's service date, and again, if I was the provider, my name would be showing up here, and here I'm going to change this to, this was a verbal order given to me by Dr. Demers. I'm going to save. And of course, we're going to get this duplicate. I'm going to override it for the purposes of this demonstration. But normally that's where I would stop. I'm going to click on save. And now we're going to see that this is in the orders section. The orders section is where you're going to see the medications that need to be administered in a clinic. And here's our Zuplopentixol. All right. Any questions about ordering a medication for administration in a clinic? Right. Now, let's say the provider wants to write a prescription for the patient to take home. They noticed that they had a rash, and the patient asked for a cream for the rash. To prescribe, you click on the medications tab, and in here you would search for the medication. So I'm going to look up some betamethasone. And I would choose the appropriate betamethasone product, and we're going to have it applied BID. So here, I'm going to prescribe 15 grams. And here we have the patient's preferred pharmacy is this particular pharmacy. If the patient chooses to go to a different pharmacy, or the product that you're prescribing needs to be filled at a particular pharmacy, you can remove this pharmacy from that list, and then have the patient bring the prescription to the pharmacy of choice. So I'm going to say, okay, that's okay. I'm done with prescribing that. Again, you're going to see that this is a new prescription, and it is now under the medication section because this is a prescription that the patient will be taking and having filled at a community pharmacy. I'm going to click on save. And here you're going to be presented with a summary screen. And the action here is that we're going to print the prescription for this betamethasone. I'm going to save it. And I'm just going to do a preview instead of actually printing this so that everyone can see what the prescription is going to look like. There. I don't know if you can see this, but the prescription ends up being printed with all of the patient's demographics. The allergies will print on there. Because I didn't remove the patient's preferred pharmacy, the pharmacy will print up there. There's a spot if you have special dispensing directions that you want to include on the prescriptions. There's a location here for you to enter such information manually. When it's a provider printing the prescription, their name and ID will, multiple prescriptions would be on one page. When it's a provider printing the prescription, their name will automatically fill in here, and they would just need to physically wet sign the prescription. But because I'm not a provider, the name does not automatically print. And so the provider would need to print in their name and put in their CPSO number. All right. And as you'll see, the clinic name shows up as well as the address and phone number for the clinic. All right. All right. I'm working from a remote desktop, so pardon me if I don't want to make anybody dizzy. So now, what does all this look like on the patient's chart? I'm going to open up my patient chart, and as demonstrated by Carolyn earlier, you can see Carolyn had mentioned that all of the widgets are customizable, and you can decide what you want on your summary screen, and you'll see that I have very different widgets than Carolyn. So if I wanted to see the patient's medications, there were no medications given yet this visit, but I can click on home medication, and I'm going to see the home medication list. These other medications that you see here that are discontinued will be home medications or clinic medications that have been discontinued in the past. All right. But the active medications will show up. And you'll see here that we have an order for something to be administered in the clinic, and it's still in an active status because it has not been administered yet. Next, I want to show you, Carolyn, are you okay if I go in and do the administration of the Clopixol so that I can show them the flow sheet?
Sure.
Carolyn?
Yeah, go ahead.
Okay. So I'm going to go into document. I'm not going to recall anything. And I'm going to exit this document. Okay. I'm just going to do a regular clinic note. You can see there's a lot of different clinic notes. What's the general clinic note called, Carolyn?
You can just do an AM clinic intake. You passed it.
AM clinic intake. Okay, and office procedures on there?
Yep.
Okay, so I am going to go like this and minimize everything. Yes, so office procedures. In order to administer the medication, everything is under the office procedure section. You'll see that there's previously, there were some medications administered in this particular clinic. And then we have one here that's that needs to be administered today. So you can see its document is incomplete. So I would click on the Zuclopentixol. And we're giving it IM. And because I'm not nursing staff, I don't know if this is appropriate, but I'm going to give it in the left deltoid. Then I'm going to document that it's been given, yes. And that I dispensed that I gave them 0.75 milliliters. Okay, and now I'm going to save. And then we're going to see that this has been completed. And then I'm going to sign this procedure document. Okay. Because this particular clinic is a recurring clinic, you're going to see in this, the office procedures listed for anything that's been administered in the clinic, the entire history, but it'll give you what date, and then the date of the clinic, who did the documentation. Okay, so this is the clinic from today. And this was administered last week by me in the clinic, and then this is what was administered today. Another way to see that, and this would be viewable from the chart by anybody. So when the patient goes to emerge, they're able to see this information as well. But we have an injection record flow sheet. So here I am going to go to the injection record. And you can see here that Sublocade was given on these 2 dates, and that the Clopixol was given today. Now, the injections that show up here are the ones that are administered within the clinic itself on site. We also have another methodology for anything that's administered. I don't know if you have outpatient clinics where the workers go to the patient's home and administer their medications or not, but we also have a workflow for that, which Caroline can demonstrate for you guys if you need that.
Yes, we actually have a lot of clinics like that.
You do? Okay.
Yeah.
So we do have special, I'm going to go back to the document again to get here, and then I am going to search for ACT, MedAdmin. And we have this built out where we have different documents for if the clinic is the one in charge of the medications at all times and they're the ones receiving it. There's the receiving documentation for the medications. There's the medication administration record. And so this administration record, you can, I'm gonna go to Rapid here. So you can say what time you were there, what actions you took, if you were bringing the medications with you and delivering them at the time, if there's any new prescriptions, if you had to give an injection, that sort of thing. If you do the administration, you can say if they were in the blister pack, if there was any PRN meds administered, and if you did administer PRN medications, what they were. Then for injections, you can say if an injection was administered at the patient's home and when the next due date is. Now, the reason for that is that we're going to say today that we administered the patient's paliperidone. 100 milligram dose. Again, please, I realize that you would not do this at the same time as clopixol. I'm just trying to demonstrate the documentation piece on here. And so we did IM, again, I'm going to assume left deltoid. Next due date is going to be in 28 days from today. So here I can do T plus, whoops, T plus 28. Hit enter, and that does 4 weeks from today. And then there's a room for patient for comment. So I'm going to say patient tolerated injection well. All right. Okay, so now I'm going to sign 0116. All right, so now you're going to see in the ACT medication administration that it's a different section than the office procedure injection, okay? If we go back to the chart and look at the flow sheet injection record, you're going to see it's not going to show up there. Where you will see it is under the registry. And I have to get going, but so Carolyn, are you able to show them the registry and where they would see those injections on there?
Sure. If I could share again, let's see.
Yeah, so I'm going to stop sharing.
Almost out of time, so.
Yeah, no, I apologize. There's a lot to show.
Yeah. Do you see my screen? Yeah, okay, I'll just show the registry really, really fast. And then we'll try to get to some of the questions. So basically we have some registries built out for some of the clinics. This is one, the ACT team. This one was built specifically for medication management for their IM injections. And as you can see here, MTest, where's your fall page?
It's AmTest FA demo. Yeah, right there. Keep going.
Right there. There you go.
Yeah.
This is the one that she documented on today. If you click on here, you can see right where she documented from and things like that. So this team, they find this really useful. They were really struggling with keeping track of their long-acting injections. They were using the PCS system before ambulatory, and they were I think using like an Excel spreadsheet. They did have quite a few med incidents because of this, so they're finding this very, very helpful. They can clearly see when they're coming up for due and things like that. Okay, and we have other registries as well. Should we get to some? I don't think we'll have, just get to some of the chat questions. I don't know if I can see it.
Yeah, one of the big ones we wanted to ask about, it was in the chat, but I've gotten a couple of side messages here around the ability to sort of this idea of not these files not being accessible to everyone. So mental health, I know sexual and domestic violence, things like that has often come up as an area where we wouldn't share with the entire organization. So there was a question from our Dryden folks as well as St. Joe's. Can you talk a little bit about that and how that works and expands?
I think Julie has her hand up, so I'll let her take that one.
Thanks.
So probably where you have and Kat can probably speak to a little bit more about how those work in Expanse and how we can keep those locations confidential. The problem really not the hospital's decision that these visits are not viewable to everybody else, and it truly is up to the patient to determine want other healthcare providers to see that information, because as I'm sure you can relate, that all information on a patient is important, and how that information is viewed we also sign confidentiality agreements to ensure that we are only viewing information that is required to perform our jobs. And having been worked in the emergency department in a previous life, understanding that sometimes those locked visits or confidential visits really do become problematic when you're attempting to treat somebody when they appear in those areas. So currently, and Kat, you can correct me if I'm wrong.
That's exactly
we
what
do
I
have-
would have said, Julie. Sometimes it causes issues to have confidential patients. So it would have to be.
So I'm not saying it's not possible, but we're
No,
certainly
that's right.
not. We don't recommend that as an approach, and it's becoming less and less acceptable as an approach in general. So if that's something that you're currently doing now, you might want to review those processes and determine on whether or not that is something that your site wants to carry forward. Acknowledging that it does cause some disruption in the viewing of patient information as sometimes at critical times. So not something that we recommend, but is something that is possible.
Sandra, can I just chime in? And is this the kind of thing that will come out through the clinical validation work that's going to happen, where the specific work groups and teams will test those scenarios, flush through those scenarios, and really weigh out the patient's right or client's right to share their information, have information shared across the record with the goal of an interoperable record, but also those purposeful, unique situations that I'm sure many of the parties here have, that there is very specific reason why either entire instances or details of instances aren't readily available to everybody. And that was my understanding of what was going to come out through some of the validation work. Is that right?
Julie, can you confirm that's something that will be gone through in more detail in the working groups, and they'll talk a little bit more about that?
We don't specifically go through it in any clinical working group. The mental health sub-working group, Carolyn, I don't know if that's something that I'm sure it's come up from the Northeast states. So I'm not sure if it's part of validation, as my understanding of validation is at this point in this project, but certainly something that would be discussed probably at both the patient access, which would be registration, and specific working groups that would typically apply to.
Can I chime in for a second from a health records perspective? Currently, we don't use confidential patients. It's something that we used years ago and found it didn't work for the same reasons why you're saying now it's not working for you guys. Because when the patient shows up in the ER, there's no record and it's really hard for the doctors to treat. I'm more concerned about the sealed record. Like a patient now can go into a hospital and say, I don't want my records being seen by anybody except for, Byron Ball. He's the only person that can see my record is Byron. And the health records department sit down and talk to the patient and say, this is what will happen. It could lead to your treatment not being done right. It can lead to all kinds of conditions. And they sign a document to say they are okay with this. So then they're able to hide those visits that they don't want people to see. And some of them are mental health visits, because when they do walk into the ER, they are treated differently because a lot of them think that they're drug seeking. So it does mean for some people, they want those sealed visits. I think that's what we need to look at more to going, and that's right, there is a stereotype for that. So yeah, I think that we need to look at the sealing of a record and maybe ask those questions. And those questions need to go through the validation. Like, how are we going to seal visits? Because I know now, if a patient goes into St. Joe's, they're only sealing the visits for St. Joe's. If they go into Thunder Bay Regional, they're only sealing the visits for Thunder Bay Regional. We don't seal the whole record. So those are questions that I've brought up. So I'm not sure if this is a great time.
So I just saw in the chat like that this might be something that's a little bit more obviously needs to be discussed and probably needs to be discussed in a different forum, maybe the health records working group or the registration working group, some of the mental health ones perhaps. So I'm hoping we can maybe just table some of that, understanding that we've flagged it as something we would like to talk about, at least in the Northwest. And I see Stephanie Brooks has her hand up. She's the mental health working group lead. So I don't know, Stephanie, if you were going to chime in with anything, but any difference in that?
I'm the mental health working group lead and the HIM working group lead, and it is the sales record. It is on the agenda for him, and in terms of the validation with mental health, even if it's not one of the specific workflows that needs to be validated, it will definitely be a workflow that we talk through with the mental health group, so that we can make sure that everybody is on the same page and understands recommendations and has a good concept of how we're going to move forward. So we will cover it well.
Okay, and just some clarification from Dryden. They were saying they were wondering specifically around mental health therapy, so probably some counseling. If people are doing counseling, and those notes are going into some of these files, so you know, sessions that you would have with a therapist, and where would those notes go? But we'll leave sort of that section there. There was two sort of more general questions, and I do recognize we're over time, so if you have to go, apologies for running over. We will post the recording. So one was about right back at the beginning from Dr. Cheng, asking about, do you have to click on all the tabs in the chart view to see that there are notes there, or is there some kind of summary or notification that you would get when there's a new note for this patient?
Julie, is there different functionality for the physicians? Do they get like a workload message?
No,
No, they don't. Okay, so I was wondering.
no. So no, there's not notifications of new documentation being entered. You can have, as part of your widget, a documentation section that if you refresh it, it will obviously show new documentation that's been applied in the date, time, etc. But no, nothing that would necessarily notify you that something else has been entered into the chart.
Certainly, maybe.
I don't know if I make.
But I guess if they were interested in a certain type of note, like say they wanted to see, they could use this widget. Maybe that's why you went to the screen, Carolyn, to sort of say.
Yeah, exactly. Yeah. This is very customizable. It's really good. See, a quick question. I just want to answer a quick. Can two people be in a chart? Yes, there are some cases. That's why I didn't answer on the chat. I wanted to explain it. There is a couple places in the chart where two users can't be in the chart. For notes, they can be in the chart. There can't be two users in the order management system at one time. I think there might be another section, Julie, I can't remember, but because, and the reason for the orders is because if that order is still crossing, there's risk that it hasn't crossed over, and you'll get like a prompt to say someone else is in this chart. We don't get it though if there's two people documenting. I think allergies too, and it's just because it's still crossing. That's the reason.
Yeah, there's a medication administration won't allow two users in at the same time,
right? For
obvious reasons. Same with orders.
And Julie, big question about they're using Caseworks, and does this interface? I would think no.
I haven't heard of that interface. It depends what you're trying to interface, right? So if it's a simple ADT feed, most third-party applications and software could support that. Yeah, I saw that question too. It's up to your site, right? Like, can Meditech be used all-encompassing? Yes. You know, the Northeast hospitals are currently doing that. But that's up to your to decide whether or not you're going to continue on with your third-party applications, or everybody's moving to Meditech.
And does Meditech meet all the ministry data requirements? I can speak for North Bay because I've worked at North Bay for quite a long time, and it certainly does. And they pull out all this data from all these different. They have they have like their BI department pulls out a lot of the data, but it definitely comes from documentation, it comes from registration, it just it comes from all different components of the chart. Like I think I mentioned earlier, I don't know if you're familiar with the data, things like that, that's built within the documentation. So we've had some screens that's just built for statistical purposes as well for that data gathering, but I would say 100% meets all the requirements.
So all required, and that's a good point, Carolyn. So the MHPDS, which I believe all sites in Ontario need to go live with by, I don't know, the ministry keeps changing the date. Originally it was December, now I hear it's June. Yes, currently the live sites are working on extracting that data for submission to ensure they can meet the criteria. But we only focus on those submissions that are actual requirements. So if your site's doing the quick RAI in ED, for example, Meditech cannot meet that requirement, and it won't meet that requirement until the ministry mandates it. So Meditech will only allow submissions via Meditech for mandated reporting requirements, nothing that it's a nice site has, is submitting this information on the side. It's only mandated requirements.
Another question is, when the prescriptions print out, you showed the thing, would every script be on its own page, or do a number of scripts go on a single page? Like say there was 3, do they go on the same page?
Don't remember that. And Leanne is gone, I think. I can get back to you with that answer though.
Okay.
Leanne did answer that. She said it's 1 page.
1 page, okay.
Yeah, I'm fairly confident it's 1 page.
Oh.
Obviously, unless you're writing 20 scripts, you might get a page or 2. But,
okay, they go on script. Okay. So I'm just running through here trying to see.
Yeah, I see that they like to have more comprehensive. I know it's really hard to demo these things on a 1-hour demo, like unfortunately. So that's why we left the registration piece out today. But yeah, for sure, there's so much to cover.
Yeah.
It's really hard to cover everything. We did try to focus on some questions that were sent to us. So, but just really quickly, I saw some other questions that were sent. Can you do group notes? Yes, you can. What were some other questions? There was a lot of questions.
Yeah. So obviously there's lots of different templates. This one.
Tons of different templates. Yes.
For assessment reports, okay, for different people. Yeah. If you haven't read something, like if something is new, you haven't looked at it, does it turn red? I know sometimes that happens with like lab results or something like that if they're new. But like if there was a new note, would it be a different color?
I don't think so. Ideally, I used to do that in our old system, but I don't think it does anymore.
Okay. So you couldn't tell just from looking at something whether you opened it previously or looked at it previously.
But remember, the doctors would get, right, Julie, some workload messages, right, for some things.
Yeah, there's some workload messages for certain things, that like a new consult notice. So if your psychiatrists are being consulted by internal medicine or something, that will go to their workload and populate as red. But anything related to documentation, so provider notes or nursing allied health notes, will not.
Okay. So show that you haven't seen it. Okay. And then this one's a little bit more technical, and I think you hit on it a bit, but the MHA PDS data set, will it include how the pre-visit is managed? So screening, referral dates, wait lists. And second part to that question, is that interface, the FHIR interface, to the province being built by one, or do the hospitals themselves have to build that?
No, we have all provincial interfaces. So I'm going to say I've seen an email across my desk, and I'm 95% confident that Jen, our interface manager, is working on that with her team and the existing hospitals, but I'd have to confirm it. But I do know that they are working on the data extraction, and it would include all mandatory requirements. So,
and Julie, I think North Bay is doing that right now. They're working on that right now.
Yeah, I think you guys are. I think North Bay went live. They were a beta site or a pilot site for this. So I'm
It's been a long
Fairly
time.
confident that they're already submitting.
Yeah, I was talking to them last week. They put a lot of effort into getting that up and going.
So thank you. That's all the questions that I see. I don't see any other hands up. I do want to let people know who are watching this or still on the call that, of course, this was just a taste of what is to come. So there's lots of work to still be done through working groups, through talking with subject matter experts, content, validation, all of that kind of stuff is coming. So there will be more to see on this. And we did just want to get just to show our sites that there is very robust mental health functionality in the program, and that we will be able to hopefully address a lot of concerns with this, but we'll continue to work with the identified subject matter experts for this. So if you have any additional questions, oh, Byron, I just saw your hand go up.
I don't know how that happened.
Oh, you were giving one of these, maybe, I don't know. Okay, but thank you very much again. This will be posted on our website as well as available from any of us. So please let us know if you'd like the recording or to share it with any colleagues. And thank you so much for attending today. Much appreciated. Thank you for our one colleagues as well for your time.
No problem. Thanks.
Thanks all.
Thanks, everyone.
Thank you.